Assalamu alaikum, the communication day. First scenario, you are the junior doctor on the medical ward. 55 years old patient, Mr. Ahmed, has recently undergone a CT scan on the shift. The scan has revealed a suspicious mass consistent with lung cancer. You have been asked to explain the finding to Mr. Ahmed and discuss the next steps. Ready, operator?
Hello?
Yes, ready?
Yes.
Yes. Ready.
Hello.
Hello.
Hello, my name is Dr. Al-Mahdi. I am doctor in medical ward today. Can I confirm I am talking to the Mr. Ahmed, 55 years old?
Yes.
Mr. Ahmed, we are here to discuss about your condition. That's okay with you?
Yes, doctor.
Do you wanted anyone attended to our meeting today?
No, I'm okay.
Mr. Ahmed, can you tell me what do you know regarding your condition?
Yes, doctor. Recently, I have this cough. It is really bothering me a lot. And when I came in, the doctor did a scan for my chest. And I'm here to discuss with you the results of this scan.
I'm really for your suffering. What do expectation from our meeting today?
To know exactly what's the diagnosis, why I have this cough.
Okay, Mr. Ahmed, can I ask you how you feel today?
Still, I have this cough. It's really bothering me. But this medication you've been given me, help it a little bit more better.
Well, Mr. Ahmed, the imaging of your chest, I'm afraid to tell you that is not good.
Okay, what does that mean?
The imaging of your chest that reveal you suspicion you have the shadow, the mass in your lung.
What does that mean?
I'm sorry for these bad news. The imaging that revealed the mass suspicion have the lung cancer.
What? Why do you need to have a lung cancer, doctor? It's just a cough. Are you sure?
Your worry is understandable. I admit your concern. I know this this painful condition for you, but the imaging that reveal there's the shadowing or the mass, still there's suspicion the lung cancer. For that, you need the further imaging and the further testing to confirm that. How does that sound for you?
It sounds very bad, doctor. I never suspect that I have cancer. I always suspect that it may be infection. If there is any possibility this mass you are seeing in the CT scan is just infection or something else, not a cancer. I never suspect that at all. I'm just 55. I'm still young. I have kids, I have kids. No. You are just telling me my life is ending. Oh my gosh. I never suspect that at all.
Mr. Ahmed, your worry is understandable, but the imaging that still is not confirmed that you have a cancer. For that,
That's very good. So there is at least there is a little bit. Maybe it's not a cancer, isn't it?
Mr. Ahmed, can let me to explain more. The imaging that have that reveal that shadowing that mass, the cancer one of the cause. For that, you needed to other the further test to confirm. Are you follow me?
So still, doctor, you are not 100% sure that I have a cancer. And this mass, it may be another thing more than a cancer. There is another possibilities. Why we never think about the other possibilities and we'll go directly to the cancer?
Your worry is understandable. The cancer is the one of the first possibility. For that, needing to the further test to confirm. How does that sound for you?
Really, it's really painful. So what other investigation do you think that I need?
You need the further investigation to confirm. Sometime maybe do yes, need other investigation to confirm, like taken to the snip from these the mass to confirm if there's cancer and which the type into the cancer, and leading to the further imaging to confirm.
Okay,
Are
so
you getting me?
yeah, so what other imaging you asking me to do? I did this is CT scan, and I think this CT scan is the one of the most advanced image. Do I need another kind of CT scan or what?
Your worry is understandable. You needed into the further imaging. Sometime you needed to take into the snip from these the mass to investigate it the more to know if this the mass to know if this the mass is cancer, and also to know exactly what is the suspicion growth.
Okay.
Are you with me?
Yes.
Do you have any concern at that time?
I'm just shocked. I'm just shocked, you know. I'm just shocked, doctor.
I am really sorry for these bad news, but be sure we are here to help you and supporting you as much as we can.
Okay, thank you. How can you support me? What things you can offer to me?
Until now, the mass is not confirmed. You needed to the confirm. After that, I will be arranged to the other meeting to discuss about the result and the plan of management.
Okay.
Do you have any other concern?
As I told you, I'm shocked, and I'm I'm wondering if there is any possibility this is not cancer. Why we go directly to that end of this? And I understand from your what you are saying that is still there is the possibility of cancer is the largest one. But I feel like if you give me a little hope, this will not be a cancer. I will be in better position.
I know, I understand your feel, but still we need to the further investigation to confirm and to rule out the cancer.
Okay.
Can I ask you some social questions?
Okay.
What's your job?
I'm a taxi driver.
Do you smoke?
I do smoke, yeah.
How many cigarettes per day? For how long?
I've been smoking for a long time, since my teens, and around 15 cigarettes a day, 15 to 20 cigarettes a day.
The cancer the smoke can be a bad effect into your health, and highly advised you to stop into the smoke. We can help you by refer to the smoking cessation clinic. Do you drink alcohol?
Socially.
Do you have any other concern? And also, I will refer you to the, and also I will be give leaflet and brochure to read more about, and website to read more about your condition. If you have any query, please do not hesitate to contact with us. Can I ask you with who you live?
I live with my family. I have 2 kids and wife.
With who supporting you at?
I'm supporting this family.
Do you have any other concern?
I'm really concerned if I have a cancer, how for whom I will leave my kids. Mostly I will be ill, I can't do my job, and my kids will suffer a lot.
I acknowledge your concern. I know this. Until now, the mass is not clear. For that, after the complete investigation, we arrange it to the other meeting, and also I will refer it to the group specialist to provide you the proper management plan.
Okay.
Any other concern?
No,
Okay, thank you.
thank you, doctor.
Still 20 seconds, Dr. Asha. You want to add any advice?
Advice? No.
Okay, it's 5.32 times up, Dr. Asha.
Your voice is not clear, Dr. Bas.
Yeah, time is up.
Okay.
Yeah, Dr. Naida, please stand.
Okay. How you think this is going, this conversation?
I think this patient is still because suspicion lung cancer. There's no do any bronchoscopy or biopsy. I think there's still the cancer one of one of the differential diagnosis, but still is not confirmed.
Mm-hmm. Do you think you give him false hope?
I think no.
Mm-hmm. Okay. Okay. So, yeah, I think it's still a suspicion of cancer, but we are in that pathway. Yeah, we are in that pathway, and I think in this case, I will not give that. We are not quite sure. We are not quite sure. If you are not quite sure why we are breaking the bad news in the first place, it's highly suspicion mass and highly suspicion cancer. So the cancer is the first is our first diagnosis. So we just need to confirm our what we think it's a cancer. So I will go. I will not give a false hope for this gentleman that it's maybe not a cancer. I will be there, but it's still there is a little percentage to be not a cancer. You understand what I mean? So the main thing that you go through that way, it is a cancer until proved otherwise. Not, it may be a cancer, it may be another thing. So this will give suspicion of the case. You are not quite sure about something, and you are breaking bad news for something you are not quite sure about. Because you are breaking bad news. If you have a mass, and this mass may be is pyroguloma, why you are breaking bad news? Understand what I mean? So if you have another suspicion of something else, it's still there is a suspicion of something else, but it's very low probability. That's why you give the bad news and you tell the patient that the support you will you tell him about all the support you can give during this time. You tell him exactly what support you can give him and which people. So you need to do a bronchoscopy and everything, but this can be done through the MDT, the lung MDT, not through not through you. So you need to refer this patient and tell him that we are refer you to the specialist team. So they will run the further investigations. It is not a CT scan again. It's
yes,
not a scan.
not CT scan. If the patient asked me, need CT scan, I said no, needed to take snap from this the mass.
Yeah.
Mm-hmm.
Okay. Otherwise, your start was very good. That you confirm the patient, you confirm that you how far he knows about his condition and what the expectation. All this was done very good. You give him the warning shot that I will give you bad news. The only thing that when I felt that you are a little bit hesitated in the giving the diagnosis that it may be not cancer and you are like a little bit hesitated in this area, I felt as a patient that if there is a possibility that it is not a cancer, why you are breaking the news until you have the at least you are sure at least 80%. this cancer, then you will break in the news. You understand what I mean? That means if you have highly suspicious mass, this is a diagnosis for you with little possibility of not being a cancer. So you prepared your patient for a cancer anyway. If it is not a cancer at that time, there is a relief. But work as if it is confirmed a cancer.
Yes, but and you need this patient deal as the breaking bad news, because the patient is most likely has a cancer, but you needed to do other I under يعني this the patient, but we needed to do other the further investigation to confirm. But
Yeah.
most likely, high probably the patient the cancer. For that, I am taking the scenario like breaking bad news, but still suspicions that there's a small percentage that there's no cancer.
Yeah, I agree with Dr. Rasha, Dr. Maida. There is possibility to be cancer, right?
A high
Yes.
possibility. So
High
that
possibility, so it will be breaking bad
but
news.
it is breaking bad
Even,
news. It is.
yes, it is.
I have no doubt of that. My question for her
Yeah,
that she hesitate in giving the bad news itself, that it may not be a cancer. You will not tell like that. You tell this is mass with high suspicion of a cancer.
exactly. It's high suspicion, but
Uh,
still there is possibility.
when the patient I told when I am the patient told her that it may not be a cancer, I'm sorry, it's highly suspicious of cancer. There is a very narrow window to be not cancer, but to not give you a false hope, it's unlikely. So the patient will be in the tract of cancer all the day, not giving like maybe yeah, it's maybe, we'll make sure, we are not sure, not like that. This is hesitation in the diagnosis. I will give clear diagnosis, this is a highly suspicious cancer. We hope that maybe it's not, there is another window that it may not be a cancer, and we hope that's the case. But at the moment we are highly suspicious of a cancer, I'm afraid. So the patient will be in the
Yeah,
tract of bad news.
I agree with this. Particularly, it's written there, consistent with lung cancer. Consistent with lung cancer means the possibility may reach 90% or above, right?
Yeah.
So still, it's breaking bad news, but the hope, like it's maybe, yeah, it's a little bit to be not a cancer.
Yeah.
So yeah, I will not give this false hope, but still I will work as possibility. I didn't confirm yet. I think Dr. Rasha did it in a perfect way. Really, she did everything. She did the introduction well. She break bad news, warning shots. But the only part important she missed, which is the MDT, multidisciplinary team. It's not a matter of only I will do a snip. No, I will refer you to multidisciplinary team, group of doctors. Don't say multidisciplinary team. What I mean, uh, just refer to group of specialists. They will do the best interest for your condition, either snipping or repeating CT with contrast, whatever. But she will confirm by another test. If she asks you what other possibility or what other test can be done, you might say it's a snip. Yes, might be a snip through a camera scan, or it might be an image again with a dye, mean contrast, to confirm is it a cancer with the spread or no. But still, the cornerstone of this scenario, breaking bad news, the possibility is still high, consistent with cancer. So what we will do to confirm that news? Sorry.
No, 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 continue.
Yeah. So sorry for the interruption. We'll go back to the missing defect here in this scenario, the occupational support. He's telling you that I have a wife and kids dependent on me. So what support you can offer, Dr. Rasha here? The occupational worker,
Social,
not only
yes.
social.
Mm, mm.
Yeah, he need another job maybe. he need to be supported financially, maybe.
Financial, yes.
Yeah, not only socially. Okay, so you have to refer him to a occupational worker to either to reallocate him in another job he might do with low energy, because this patient is sick enough. You might say we can give you sick leaves until confirming the diagnosis, or until we put the management plan. He might need radiotherapy, chemotherapy. You don't know what will happen in the next days. The last thing, the smoking here, yes, one of the triggers. So you can tell him you have to stop smoking. You don't know the stage. So don't tell him, no, this patient is already having a cancer. I will not advise him. No, still the possibility is not confirmed. So you have to advise him about stopping smoking totally, not only talking about smoking. You have to refer him either to tell him you have to stop smoking because it might be a trigger of your cancer. And if you need some support, we will refer you to the smoking cessation clinic. They will help you how to stop it. Okay, otherwise, Dr. Arasha, if you do this case in this way, you will get at least, for me, 18 out of 20. You did everything in this scenario, really. Well done, Dr. Rasha.
Yes.
Any
Yes, but
suggestion? Yeah.
because regarding this scenario, I think if I say this the patient the cancer you need affected to do other the next step like refer to the patient to the Macmillan nurse, refer to the patient to
No, no,
the
no, no.
that
Still.
you yeah yes you mean for
Mhm.
that I can't to give the patient this the cancer because if I said this the patient is highly possibility the cancer you need to affect it to the other clinical judgment like refer to the patient to the cancer doctor, refer to the patient Macmillan nurse, ask the patient if there's any chemotherapy or
All these
radiotherapy.
steps will
Yes,
be done
yes.
after the snip
Us
or the
must
biopsy.
after confirm. Yes, for that,
Exactly.
not give
Yeah.
the patient like cancer or not.
No, no, I
Uh,
agree
mm,
about what you did, Dr. Rasha. You did, not in the midway, but you are consistent with the cancer. But still, we have to confirm. So what you did was perfect. For me, it's perfect and amazing. You didn't give him any false hope. Yes, there is possibility, but you didn't stress on this point. You didn't tell him a lot of a high possibility to be not a cancer. So what you did for me is perfect. Okay, and
yes.
also
Also,
Dr.
for me,
Maida
the
confirmed
scenario
it.
is not clear. For that, give is
Yes.
not clear.
By the way, it's uncertainty. Don't go as a breaking bad news for a cancer. The one who will do this scenario as a cancer, clear cancer, breaking bad news, and it's confirmed a cancer, he will miss the case. You shouldn't give him confirmed diagnosis as long as there is a word written as suspicious. So it's uncertainty. There is possibility, although it's high, but still we are not sure. We will need to do other tests.
Yes,
Clear?
because the cancer is not diagnosis only from the CT chest.
Exactly, yes.
Mm, okay.
Okay, any other questions? Dr. Maida, you want to add anything?
No, I just I agree with Zoom user. He said you need to ask the patient to confirm how he came to the hospital because you need to offer a taxi driver or anything.
Yeah, good thing. Yeah, all supports here will be precious for the patient. Any support here. Okay, you can tell him yes. And Dr. Rasha did good, also did good when she said to him, "Do you need anyone to attend this meeting? You have to invite someone with him to support him." How do you feel today? Also, another question, which is good. What's your expectation? I think the introduction was
It
perfect
was
here. Yeah,
perfect.
yeah. She did
Her
everything.
question was perfect, but I disagree in the middle. There is some suspicion for me. Maybe this is a
Yeah,
good.
you want
Yes,
not
yes,
to.
yes,
Yeah,
doctora, yes, and also for me because I am hesitated. I don't know if talking the patient like the cancer as breaking bad news of uncertainty. It's also for me I hesitated for this scenario
yeah,
because I don't know if the patient you want to talk about the cancer or like uncertainty. For that you feel like hesitate. Yes, it's also me hesitated regarding this scenario.
So
yeah. But for me, Dr. Rasha, sorry for interruption, Dr. Maida. For me, it's better than saying it's confirmed diagnosis. It's a cancer. I'm so sorry. The lifespan of the cancer is low, and you will go through the cancer step as a diagnosed cancer. No, still we have to do further testing as written in the scenario. The next steps have,
It is
yes.
fair testing, it's warning shot the same, it's breaking bad news and everything, but with little hope. This is my
Yeah, I agree with this. Yes, I agree. Yeah. Thank
I
you.
have another. Yeah,
Yeah.
excuse me.
Yeah, sure, sure. Go
Yeah.
ahead.
Yeah, I think also she may ask like for the smoking history before she go through the condition. Like,
Yeah.
yeah, how much you know about your condition, and ask him first. Do you smoke or you have history of smoking? And he will tell her, yeah, he has long history of smoking. So like making it as an introduction. Like, yes, the CT shows very suspicious mass matching with something sinister, and based also in your history, long history of smoking, this like scan or showing very suspicious mass for
Yes,
cancer.
yes, yes. But the
This
cancer
could,
one of highly possibility. Yes.
yeah,
Yeah,
could
good
Yes.
this
point.
be something else, doctor? Very tiny possibility, but we
Yeah.
will make more investigation to confirm. But the top differential or the top diagnosis will be cancer based on
Cancer, yes.
the mass
Based in
and
history. Yeah.
based on your history of smoking. I think you can ask him also if have his history of hemoptysis or blood with cough, or maybe if is it possible.
No, no, no. It would be as a taking history. What you want to do,
Okay, just
you
you can
can
ask
give him.
about the smoking and
Yeah.
the scan, because it
Okay.
in the paragraph it's mentioning consistent with lung cancer. So
Yes.
I think he is the main idea is to break bad news and
Yes.
like I, because I felt the doctor like giving him hope, then it mentioning but it's cancer, but it could be something else. يعني من الاخر كده حاسس انها فسحته شويه.
Ah, okay, okay. I agree. That's why.
Okay,
That's why also Dr. Maida give the same comment. Don't give any false hope. Yes.
Yes. Mhm.
Totally
exactly.
agree. Thank you, Dr. Karim. I want to comment on your comment first. The smoking history. I agree to ask, but some examiner they might say that you blame the patient, or the patient might feel regret. Oh my God, doctor, you mean that this is the cause, and you give me the 100% pathology or the cause of the cancer, smoking. I think it's not the 100% cause of the cancer is smoking. Some other occupational worker might be the reason. So I don't I don't think, this is my opinion, but
Hmm.
it's still open for discussion, to raise it earlier or to raise it later on. For me, I will not do it as the introduction, because the patient will feel guilty. Oh my God! So you mean this is the cause of my cancer? Only the smoking. This is my advice. The other thing, don't take any history or question related to the medical history. If you want to say, you can give him some safety netting, some advices, or at the end, red flags. Please, if you cough up any blood, or you have any chest pain, please don't hesitate to visit us or to call your GP. Why? Sometimes the biopsy or the endoscopy or the bronchoscopy might be arranged later on, or it might be delayed because of some busy appointments. So till that time, you can give him some red flag. That's why I asked Dr. Rasha, do you want to do anything at the 20 or remaining 20 seconds? You can give him some red flag, any cough of blood or any severe chest
Yes.
pain. It would
Mhm.
be much great to mention that as a red flag or safety netting at the closure of the meeting. You give already brochures and leaflet about lung cancer, the smoking, the triggers, but you can give red flags at the end if you have sometimes. This is my opinion. Thank you, Dr. Karim. It's a good comment. But again, it's open for discussion. What do you think? To give the reason and early, and to tell him because you are a smoker you have the cancer, or to ask at the end whatever the reason, but the smoking one of the triggers. So don't put him the whole blame. He will feel guilty, oh my God,
So it's
because of
not a
smoking.
blame, but
Yeah.
like based on the when you are taking a history. So based on the history of the, yeah, could be it's a point.
Yeah,
Yeah,
it could
yeah,
be, but yeah, I think,
mm,
from again my opinion, but anyone
yeah.
you want to comment? feel free to give us your comment, please.
Yes,
What
Dr.
do you
Bassel.
think? Yes, go ahead.
I agree with Dr. Mayada. This patient has CT typical of lung cancer. The criteria of CT of malignancy is very clear, so it's consistent with lung cancer. But we have to take biopsy to confirm which type of cancer, and depending on this, so patient should be offered that she has to take a snap, and this snap may be different routes. We have to discuss the steps with the patient about the maybe through camera test, through camera test through the skin, the VATS, or through the CT guided snap. All this should be discussed with the patient, and he should be consented, and ask this will be consented. And then after to detect the type of the mass, which is the type of cancer, some type of cancer may be surgery completely resected and be cured. We have to discuss this with the patient. It depends on the types of cancer. Some type of cancer is not liable for surgery. So we have to explain that and tell her that we will offer you multidisciplinary teams, dedicated doctors, of surgeons and tumor doctor and the lung doctor. All of these will detect the best of interest for you, whether to do surgery or to take chemotherapy or take radiotherapy. This will be some cases of lung cancer will be cured by make resection of the lung. So we have to give her all options, because even if it is cancer typical by CT, and we don't, this means not the end of the life. Maybe the patient will be operable. So we have to tell this to the patient, and to tell her this will be offered by the multidisciplinary team. About the smoking, no rule to tell the patient that the smoking, you have to you are a smoker, that's why, because a lot of lung cancer not related to the lungs, to the smoking. Sometimes the lung cancer is not related to the smoking. Some cases like squamous cell, yes, it is related. So we have to tell to stop smoking, of course, but don't discuss it as etiology, as a reason or underlying factor.
Yes.
Because the patient may feel that he's blamed, that you are he is punished for that. Yeah.
Yes, I agree with you. Yes, thank you, doctor. Your name, please.
I'm Dr. Judah. I'm Judah.
Because your name Zoom user. Okay. Thank you, Dr.
Sorry.
Judah. Yes. Always your comments are precious for us and valuable. Again, as Dr. Judah said, for me, I agree to mention the possible management plan. The chemo, the radio, or the surgery. But if he goes through that, if he asks you, doctor, do you think there is a possibility of surgery? Do you think I might live longer? You don't know. So even the type of the cancer not yet known, you can give the options without giving the detective plan. You don't know what is the type. So again, we will wait for the test, which is the
Yes,
biopsy.
because the patient,
Exactly.
if not diagnosed with
Exactly.
the cancer,
But
how can
if he asks you,
yes.
sorry for interruption, Dr. Rasha, if he asks you what the possible management plan you can put for me, you can say all what Dr. Judah mentioned. The surgery there, possibility, the possibility of chemotherapy is there, the possibility of radiotherapy. So
Yes.
all this will
Depend
be
on, yeah.
detected exactly.
Depend on the type of the tissue.
Exactly.
But don't say
Yeah.
maybe. Maybe mean it is not a cancer. Maybe it is a false hope. We have to tell this typical finding of cancer. We have to take biopsy to know which type of mass is. But we have to give this bad news like this. Otherwise, the patient will maybe it is mean it is not
false
sure.
hope, you mean? Yeah,
Yes.
false hope. Don't give him false hope. So you can say very low possibility to be not a cancer. Okay, so not confirmed 100% and not confirmed as low percentage as a cancer. No, there is high possibility, might reach to more than 90%, but don't mention numbers, of course. You can say high, very high possibility of cancer. If he asks you, doctor, is there any possibility not to be a cancer? You can give him, you can say it's very low possibility, very, very low, because it's written there consistent with cancer. Okay, but still not confirmed, and we'll go through the possible test to confirm the diagnosis. Clear now for all? And for
Yes,
the
Dr.
smoking,
But,
I agree.
Dr.
Yeah,
But
I
I
agree.
want to add one
Yeah,
point.
Dr. Rasha, go ahead. Yeah.
Yes, if patient is still not confirmed the cancer, I can't talk about the management plan. I can't talk about the surgery or radiotherapy or
No, not now.
whatever.
don't tell unless he asked you,
don't
doctor.
tell don't referral
Yes.
اصلا حتى للكانسر
No,
دكتور or
refer
Macmillan nurse.
to
Refer
group of
MDT
specialists.
team, but not
Exactly.
cancer doctor or
Yes, yes.
Macmillan nurse, because the
Yeah.
patient, if the patient is not confirmed cancer.
Exactly.
يعني
What if the 1% came as positive? Not
yes,
non-cancer. So what?
non-cancer.
Yeah, all this management plan will be changed, but still
Yes,
we will
is
refer
worry
to.
the patient without
Yeah,
any worry the patient without any benefit. يعني
exactly.
patient there's
Yeah.
no
So
cancer.
do it as uncertainty, even it's high possibility, but still there is a low percentage. There is a possibility not to be a cancer. Yes, it's high, but it's still there is 1%, for example, to be not a cancer. It will be confirmed after the biopsy. Clear now for all?
بص يا دكتور باسم يعني I agree with you for this uncertainty, but this is like you are looking to the a male or a female, and you don't be sure this is male or female. You look to the male and you know this is a male without taking the part body. You this he is a male. He looks with his mustache as with beard, and a female is very clear to me. The lung cancer, the lung mass, a cancer in CT is very clear like male and female. We don't hesitate to tell the patient has finding typical of lung mass cancer. And this typical, we have to take which kind of cancer. We'll not give him any false hope. Even if the biopsy come negative, you know this biopsy will be repeated. Even if, so the oncologist will be involved from the first moment to guide the management plan with the lung doctor and with the surgeon, with the cardiothoracic surgeon. Both, all of them will guide the plan of management, because even if you miss the biopsy sometimes come from the false place and you have to repeat it to exclude. It's consistent with lung cancer. For me, it is very clear. The patient has a lung cancer, but we cannot detect which kind, and we have to confirm. Don't give, if it is, if he ask me if it's not, there's a possibility for to be, it's not a tumor or it's not a cancer, it is very, very it is very, very not likelihood to be something other than cancer. I would tell like this, very, very unusual, or very, very unlikelihood
Yes,
to be
this is
something
what
else.
I'm saying. Yes, but I will not tell him this is a cancer.
Yes,
It's
because
still
it's sticky, the scenario says
Typical should
suspicion.
the
okay.
shape,
Okay, Dr.
the
Judah.
shape, and typical to be
Okay,
a cancer.
typical to be a cancer, but is it a cancer?
Until take the biopsy to know which kind and to
Yes,
confirm.
exactly. So you cannot say this is 100% a cancer. This is again
99, like it
okay.
is 99. They will not give
Okay.
the management except to know which kind of cancer and to know whether this patient is operable or not. This is
Yes,
how we will
I
discuss the
agree.
steps of
I
management.
agree with you. I agree. But by the way, the exam, the task of this scenario or the topic of this scenario in the exam will be cancer uncertainty plus breaking bad news. Agree? Right?
I
Dr.
can't see.
Zuda.
تمام.
It's not like uncertainty. It's uncertainty of the type of the cancer, not it is cancer or not.
Yes, but still not confirmed the cancer itself. By the way, if you confirm, if you mention this scenario, or if you discuss this scenario as confirmed cancer, diagnosed cancer, I think you will miss the case. Still, what's called uncertainty. Why? Because there is further test to confirm the diagnosis. So I will wait for this test to be done. If confirmed diagnosis, I will say this is confirmed diagnosis, and I will go through the all steps of breaking bad news, Macmillan nurse. Why I didn't do that?
هو بس دكتور باسم
Yes.
شغلة واحدة صغيرة لازم تنتبهوا عليها. هي عبارة عن paces rule. It's not a practical. يعني هلأ لو في معنا واحد oncologist,
Yeah.
he might not agree with us. ولو في معنا واحد
Exactly, yeah.
palliative,
Yes.
he will not agree with us لأنه practical. خلينا نحط البراكتيكال على جنب. خلينا نقول نحن هلأ رايحين على
No, we are
exam.
talking as basis wise.
As
Yes.
basis wise. أنا عندي two type of scenario. أصلاً أنا قبل ما أفوت to perform scenario, I should write in a bold in my paper. The first C. أول C كنا نقول الكاباسيتي. تاني C confirmed ولا suspicious.
Yes.
وجود كلمة suspicious in the scenario، يعني أنا مستحيل أقدر أتعامل مع السيناريو على إنه confirmed. حتى لو في oncologist لو شاف السي تي وقرا السي تي ريبورت، حيقول لي طب هات confirmed، أنا معك.
exactly
هاخده على جنب وأقول له هذا برا نطاق البيسز. هذا بالبراكتيكال لايف أنا I will have my يعني there will be special arrangement على حسب بروتوكول المستشفى و when to involve الأونكولوجيست. لكن إذا عم نحكي cases wise، وجود كلمة suspicious سواء يسبقها highly أو لا يسبقها highly، هي كلمة غيرت سكيمة السيناريو من 100%. غيرت السكيم 100%. غيرت السكيم. You
Doctor,
cannot use.
he'll try to comment in pure English because you know some doctors here.
I'm sorry.
No
So
problem.
whenever سامحني, whenever there is a word suspicion, it has changed the whole scheme. خلاص, you are not dealing with a scheme of a confirmed scenario from the first point. يعني these are three things: الcapacity, will confirm diagnosis or not, هدول وإذا في consent or not. Those three C's, you should decide about them from the start. As long as there is the word suspicion in your card, you cannot deal with the scenario as if it is confirmed. Even if there are strong evidence, مثلا smoker, it's written smoker, he gave you asbestos worker, تمام, he is 55, everything, and there is a highly suspicious mass in CT, everything is telling you I am a cancer, as one of the doctors said, as if he is a male with a mustache. But still, you have to respect that the word suspicion has been written there. You cannot overcome this word. This word has a value, have a meaning, and own most of your mark in the scenario. Most of your mark lies inside the word of suspicion. So you have to mention everything, as we still need to confirm. There was some good points. Some of you mentioned it. And I should be honest with the patient. Your mass is suspicious and consistent with cancer. First trick, use the same terms mentioned in your card. Don't invent, don't reformulate, don't use any alternative words, even if they have the same meaning. First thing, you will break the bad news using the same terms mentioned in your card. هذا first safety method. 1. 2, you will always say we are still confirming. We are still confirming. Even if the last step, يعني it can be a benign mass. هي mass بس benign. Could be. يعني something can raise later on vascular mass whatsoever. So you have to mention all the time, I am confirming. I'm still confirming. I'm still confirming. You should never let the surrogate, and the surrogate will take you through the steps. Doctor, حتى يعني الدكتورة who did the case, she told her, doctor, nothing is remaining in my life. What I will do, my life is ending. If we realize إنه surrogate is playing the role of a confirmed diagnosis, فهي again they are testing you how you will deal with those conditions. I agree that it's a grave and it's a devastating news, but still there are some steps remaining before we can tell it is a confirmed cancer. Though it is highly, ممكن نستخدم كلمة highly. Some of you suggest top differential can be used. Some of you major possibility, significant possibility. All those I agree. It should not be a possibility of 50-50. I cannot say 50 cancer, 50 infection. Who will deal with the scenario as 50-50? And I totally agree with everyone. It's a wrong way of dealing with it. It must be 80% cancer, 20% other possibility. So you will say the word major, top, a priority for us to exclude. We have to take the safe passage and work on the most serious diagnosis, which we are highly suspecting, which is the cancer. هاي المصطلحات, I all of it agree with it. لكن using these terms, it don't mean that we will overcome the word suspicious in the scenario. تمام? You will not discuss advanced directive. You will not discuss lasting power of attorney. You will not call the oncology. You will not call the Macmillan nurse. You will not speak about any modality of treatment. تمام? All those steps, because it's still a suspicion. So even if she tell you, doctor, what treatment you will offer me, we cannot tell except we complete the steps of work up. في شغلة حلوة هي سألتها بصراحة الدكتورة اللي عملت السيناريو فنانة للأمانة، سألت أسئلة كتير حلوة. She asked, doctor, you did for me CT. طيب what are the other modality? I agree with all of you. وحتى دكتور باسم انت نبهت للدكتورة اللي عملت السيناريو. انت you mentioned the SNP first. لا, I don't agree with you to go with the SNP ولا camera scan. The first thing is that there is a team responsible for your case who will continue to tell us what are the further investigation. Could be another detailed scan, could be detailed scan with a dye, could be a camera scan. بس قبل ما could be a snap, could be we image other part of the body اللي هي السي تي كام. فأنت قبل ما تعطي أي possibility, especially if those possibility are advanced modality, always mention the multi-speciality team and the medical team or the medical decision which is involved in her case, which is يعني they could have decide or they could not decide what is the next step. But what we usually do in these cases can be كذا 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 كذا, but what is the exact step? As soon as it is decided by the team, I will come and update you. تمام؟ انت حكيتي بطريقة ظهرت لنا انه انت as if you know the next step it will be a snip. تمام. وفعلا الدكتور اللي قال انت اعطيتيها فساحه بالبوسيبيليتي كمان كان هذا نوعا ما يعني شعرناه من الاسلوب. فاذا هن كانوا عم بيقولوا انه هذا الشيء تتجنبيه, فاي agree with them انه better to be like robust about your possibility, انه المajority is cancer, minority is other possibility. Whenever she asks you what is the next step, it is an MDT decision. It was not decided yet. As soon as we decide, I will come and update you. But it could be كذا 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 as a modality of investigation as we know. وكمان لي تعليق بسيط بس إنه الله يرضى عليكم موضوع الsuspicion. يعني even I feel happy sometimes when someone he argue against fixed thing, because it might be a chance to tell him that PACEs is different from the practical life. لأنه أنت you might go into the exam and you think that you are the best doctor and you're happy that they brought for you a scenario in your specialty, ولكن هي قد تكون يعني شو بيقولوا أسوأ شيء حصل لك بالامتحان, لأنك you will deal with it from your practical point of view you will miss البيسز trick. PACEs trick أساسي فيها major thing is to look for the word suspicion. تمام. في كيس اجت multiple sclerosis, البيشنت عنده optic neuritis وجايه بنكست اتاك بالسكند اتاك وشي is a female. تمام. وstill they are telling you انه we found an MRI, كمان شافوا MRI lesions and it is highly suspicious of multiple sclerosis. يعني اللي حيقرا السيناريو حيحلف انه it's multiple sclerosis female وجاها من اول optic neuritis, هو عم بيقول لك MRI lesions are بس still قال لك highly suspicious of multiple sclerosis. You have to deal with it as a suspicion. Still we need to do further tests to confirm. Still we need to counsel some people who are highly specialized in reading radiology. Whatsoever, it's not yet confirmed. You cannot tell. It is 100%. As long as in your card it is mentioned the word suspicion. هي واحدة من قواعد يعني this is one of the rules in PACES exam. Confirmed equal confirmed. Suspicion equal suspicion. Whether highly or not highly. This is يعني the learning point from this scenario. هلا we have to make a balance between the major possibility and the minor possibility. Agree 100%. It should not be 50-50. Agree. بس suspicion, wallahi suspicion.
Exactly.
I cannot tell anything more than this. خلاص, I will deal with it as a suspicion. The other minor points just I want to comment about is الانترو. لما قلتي لها what you are expecting, فهي انت when you ask about what you are expecting, her answer was لاحظي بعدين قالت لك دكتور whether it is an I was thinking it's an infection. هذا دليل انك انت سألتي السؤال غلط. كان لازم انت من البداية تسألي what is your thoughts about the cause of the cough. انت كنت عرفتي انه you would figure out انه her mind is هي على قول دكتور صلاح هي بوادي وانت بوادي. تمام. ف from the start you will deal with it more cautious and you will not make her think of more يعني of the other possibilities. ف always ask the question of expectation general, what are your expectation. وهلا it is preferably to ask what is your thoughts. بعد ما سألتي هاد what is your thoughts and especially what could be running in your mind about the cause of your cough. تمام. هذا للناس اللي بتحب تسأل. for those who like to ask general في ناس لهلا support انه ask about the thoughts in general, thoughts about the meeting, thoughts about the cause of cough, whatever. what are your thoughts or expectation and what is running in your mind, what could be the cause, I'm sorry, what could be the cause of the cough. يعني what is running in your mind about the cause of cough or what you think is the cause of cough. she would volunteer about the infection very early. تمام. يعني some people might miss the idea of expectation because they are not extracting the information correctly from the surrogate. هي when you ask the question in this way, she told you, doctor, I'm here, I'm expecting to know the cause of cough. Then later on أفصحت, she really volunteered that I'm thinking of infection. So please ask the question of the expectation very well. What do you think the cause of your cough? What do you think the cause of your symptom? What is running in your mind about what is happening with you? تمام. You should bring out of her the causes, whether they are near to cancer or very far away from the possibility of cancer. When she asks you, doctor, what kind of help you can offer me? كنت انت لسه ما you didn't reach the social, but you didn't address this very well. Later on, she raised up the problem with the family, with the finance, that to whom I will leave my family. For what kind of help? This was a very clever question. So, doctor, you're telling me you can help me. What kind of help you can give? We can support you during this difficult period. We can look into your job issues. We can see if your family need any support. تمام? If your symptoms become very bad, we can address those symptoms. And if they start to impact on your daily life activity or in your job, we can manage them and help you. For all those are a kind of help which we can offer. فأنت when she asked you about this question, you didn't really address it very well. وظهر بعدين إنه yes, all those help you had to offer them. ليش? Why I'm telling you this? Because you will not be always lucky to finish early. But if you get a chance to talk about the modalities of help, خلاص, take it, use it. And most of the time now in the 10 minutes, we miss to address with whom you are living or those issues. يعني. You might get a very panicking surrogate and she continue to move around and around the cancer. So whenever she tell you, doctor, what help you can offer me, we can offer you support for your symptom, support for your mood and for your psychological أو your يعني your mood أو حتى بنقول نحن social, spiritual, psychological. You can tell her psychological or for your mood. Okay, because these symptoms or these news have a very big impact on you. We can support your family. Always when someone asks you what help you can offer me, talk about the family support. We don't usually support the patient only, we support his family also. If you need any job support in your job, financial support, we will try to support you in all aspects until we confirm the diagnosis and decide about the management plan later on. This question is really very nice. يعني والله على يعني really the case was done very nicely. The concerns were raised even before the social, but you didn't address them until you reached the social. Try to address the concern very well. What help you can offer me? Tell her all the modalities of help before you reach the social. With job, I would love, as we ask about smoking, taxi driver type, anytime you work where you are, any work you did before where you had any contact with chemicals, تمام، لأنه هي risk factor. تمام. It's like the same يعني it's fall in the same category of smoking. Smoking is a risk and contact with any chemicals. هو هلا عمره 50 أو 55 فهي might be working in a factory. وأغلب lung cancer scenarios they are touching asbestos. تمام. I think يعني usually in such a scenario risk factor is a very important thing to address. So have you ever been in a contact with any chemicals? Have you ever been working with dust, fumes, coals, or you can sum it up telling chemicals? Have you been any time in contact with chemicals? No, doctor. خلاص, that's it. Do you smoke? We address the smoking very well. Everyone has, يعني, every one of you commented very well on the smoking. It must be stopped. If the patient pick it up and blame himself, as Dr. Bassem said, it's one of the risk factors, but there are many other risk factors which are even not known to us, might contribute تمام, to development of cancer. But please take care when the scenario is suspicious. Take care when someone asks you what help you can give me. هدول أهم 2 points really I wanted to stress on.
Okay, thank you, Dr. Hind. A valuable comment as usual.
Thank you, Dr. Tan.
Yeah. Okay, let's start the second scenario. Dr. Maida, ready?
Yes.
So your scenario, Mr. Jack, 65 years old, has been complaining of fever and altered conscious level for the last 2 days. CT brain and lumbar puncture done. For him, CSF analysis revealed meningococcal meningitis. You are the senior house officer at the neurology department. On call today, you have been asked to discuss the result with Mrs. Sarah, his daughter. Ready, Dr. Maida?
Hello. My name is Dr. Maida, one of the medical doctors taking care about your father. Can I confirm that you are Miss Sarah, the next of kin of Mr. Jack?
Yes, I am.
Okay. Hello, Mr. Sarah. Just a quick one. Can you tell me how far you know about your father condition?
Yes, doctor, my father have suffered from the high-grade body temperature and also listened the awareness in the last 2 days. I want to know what happened to him, doctor.
I highly appreciate about your knowledge. Okay, so when your father came into the hospital, as you know that he had this fever and high temperature, and he's a little bit moldy. So we did for him a CT scan. This is a scan for his brain to make sure if there is anything. And then we take a snip. Okay. Do you know about, anyone told you about the result of the CT scan or the snip?
No, doctor.
Okay. So we worked on his base of interest, and we did a scan for his brain to look for what causing him to be confused. And then we take a snip from his back. We entered to take a fluid from his back, and we found that unfortunately he has infection. Okay, are you following me?
Yes, doctor.
Okay, so what we checked, that we found that he has the sample of the fluid from the spine, and some blood tests show that he have infection of the meninges. The meninges is the surrounding of the brain. Okay.
Okay.
And the blood test, the blood result confirmed that this infection was with a specific type of bacteria. And I'm sorry to say that it is a serious type of infection. It's known as meningococcal meningitis. This is the name of the infection he had. Okay?
Yes, doctor. Is it serious?
Yes, it is a serious infection, but the good news is that we caught that early, and we have been starting him in antibiotic, and right away we give this antibiotic on his arrival, and through his veins, and we start treating him regarding this infection. Are you following me?
Yes, doctor.
Okay. So at the moment, what we're gonna do, we will continue the antibiotic through the drip for a few more days in the hospital. And most people make a full recovery. And although we will monitor closely for any complication, because the complication can happen at any time, still there is a possibility for that. What we do, we isolate him. That means we keep him in a side room, because this type of infection is sometimes spread to close contact person. And we already talking to public health precautions, so they to address to contact anyone who has a recent contact with with your father, so to give him a course of antibiotic to prevent the spread of the infection. How this sound for you?
Yes, doctor. You mean me and my family? You need to start antibiotic?
Yes, yes. So the public health precaution group team will contact you and give you these antibiotics. So it's like a preventive measures. Up to
Doctor,
this
can I see him?
As I told you, at the moment, because he's in isolation, still you can see him, but with precautions. Okay, we'll give you some precaution and isolation measures to make sure that you are this infection is not spreading. And we prefer this will isolation will be for several days until we're sure that he's okay, and then he's not infectious, and then we stop the isolation after that. Okay.
Yes, doctor. Okay.
Mm-hmm. Do you have any question up to this point?
Yes, doctor. What about the outcome of the disease, doctor?
Okay, as I told you, so this is a serious infection, but the good news that we caught it earlier, and most of the patients, they respond well to the antibiotic when this caught it earlier, but it's still complication can happen. Some of these complications, sometimes full recovery not happened, and some people end by stroke like symptom, and some people may end even need support for airway and becoming more comatose and unaware. But this is a little possibility, but it's still there is a possibility. Is that sound?
You mean yes? You mean my father is good outcome?
As I told you, it's a little bit early to say that. But according to what we have and according to the antibiotic we are given, we think, we hope that he respond well at the majority, but we can't guarantee 100% he will not develop complications. Okay?
Yes. Okay.
Okay. So at the moment, as I told you, what we're gonna do that we'll continue the antibiotic through the drips for several days to ensure that he's responding well to the medication, and the public health will contact you for short course of antibiotic to make sure that you are okay, and this prevented from you and from the family. Is that okay? Are you with me up to this point?
Yes, doctor.
Have any question? Do you want to?
No, doctor.
I just want to reassure you that we will keep a close eye on him, and the infectious disease team is involved. We also schedule for him a hearing test after recovery, so to make sure the infection can, because the infection sometimes can affect hearing, so we need to make sure that he's not affecting his hearing. We'll making sure we'll sure that hearing is not affected. Is that okay?
Hearing affected my father, doctor, you mean?
No, as I told you, one of the complication, hearing can be affected. So we will arrange hearing tests after his recovery. to make sure that hearing is not affected.
Okay.
Okay. Now, can I ask you some questions, personal one?
Yes, doctor.
Is anyone in the family depends on your father?
No.
Okay. Okay. So, do you think that you need any support?
No, doctor.
Any help? Okay. In the time being, I will give you some brochures and website to read more about this type of bacteria and about this type of infection to make sure that you are aware about what's going on. And I will make sure that have some information about the complications may happen secondary to this infection. And as I told you, at the moment, as we caught this infection early, we hope he will respond well.
1 minute left.
Do you have any more questions to me
No,
or
doctor.
any concerns?
No.
Okay. Okay, so I don't know what to do with this one. Okay, so the only thing that I want to reassure that can you tell me what you get from our discussion today?
Yes, doctor. You said my father have infection in his brain and spinal cord. You need to isolate him, and you need to start some medication for him. After that, you need assessment his hearing.
Yeah. So so this is infection. We already started the antibiotic, and you will be you as the family will be contacted by the public health team. So to give you some antibiotic, most probably to prevent the just for prevention and to make sure that there is no other one have the infection. Okay.
Yeah.
Yes, doctor.
Perfect, Dr. Maida. Well done. Time is up. By the way, I didn't write the items down to help you. I wrote it to comment or to have a comment on these things because it was missing only 1 minute. Okay, so we'll hear Dr. Rasha comment, then I will comment.
Yes, well done. But the first of all, you not see you are a neurology and a neurology department.
Yeah, I'm in neurology
Uh-huh.
department. Yeah.
Yes. The second, you said my father is done a CT scan. I think a CT is jargon. CT scan.
Yes.
And also after explanation the disease, not said you need to say my father is have cold is the cold meningitis. After that explain the meningitis. You not explain the symptom and sign of meningitis is not explain the disease itself. You mean the bug infection, not bacterial infection, serious bug infection affected to the layer of the brain, which they call the meningitis. Don't ask me about if you know about this the meningitis or not. Not give me the sign, the symptom of the meningitis. And also the meningitis regarding the prognosis is good prognosis after complete antibiotic. If you treated early after complete antibiotic, the good prognosis. And also you not ask the patient about the job for public health, for not ask about the patient the job. And also you not ask about the patient contact tracing in the previous 7 days.
So this is the public health work. So
yes, public health work. Because the patient is working to teacher, you need it to the public health in school.
okay, so I need to ask this question, or
Yes, I
just
need
I
to.
mentioned
Yes,
that
I need ask. You need ask
tell
about where
them.
the job of the patient. Yes. Okay. And also you said antibiotic and said bacterial infection. And the
Antibiotic,
drip,
they use antibiotic. Is it
drip,
jargon?
antibiotic jargon, yes. And also you say the
What I
drip.
say, apart from antibiotic, what I will say?
I think antibug.
Oh,
Yes, super bug and antibug. Yes.
Yes,
Okay,
and
But
also you
by the
say,
way, antibiotics can be because all of the
you
countries
know,
know
yes,
about
okay.
antibiotics.
Yes,
everyone
and
knows
also
antibiotic.
yes, and also you say the drip.
Yeah, what else apart from drip? They know it's called drip.
Yes, cold drip. And CT scan and the drip.
What I will say for drip?
I think the
Medication
patient.
through the blood channel. Medication
Yes,
through the
blood
blood
channel.
channel.
Yes, not the
Because
drip.
this is IV antibiotics.
Yes.
Okay.
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 Finish comment, Dr. Rasha, because I have
Yes,
short
yes.
time only. Because I
Yes.
have to finish or to end the meeting at 12:30. Sorry for
Yes, yes, finish. Yes,
yeah, for
finish.
the interruption. Okay, I will try to comment fast. That's why I wrote the items of our scenario down in the chat box. You can read Dr. Maida. So you will start by the introduction. Yeah, who are you? Introduce yourself, then ask the patient, confirm the diagnosis, confirm the data of the surrogate, which is the daughter. Next of kin, you have to ask about next of kin because this patient already lost the capacity. So you are talking to a patient who lost the capacity member or family member. You have to confirm who is the next of kin. Is she the one or no? Here, no need to give permission or to say, I have permission from your father, because already written in the scenario, he had altered mental state. So you cannot assume that you got a permission, okay? You can invite someone, yes, you can invite someone, because as I said, always, the patient lost the capacity, so you can invite second person. So the third person rule here is not there because the patient himself lost the capacity. So you can invite the second person or the second family member or whosoever, or second person, I mean. So the daughter, or maybe her brother, her sister, the uncle, whosoever, as long as the patient lost the capacity. The question, if the patient is still awake, so you have to confirm that you got the permission from the patient and don't invite anyone else. Okay, next step, the breaking bad news. Is it breaking bad news? Yes, because the patient already lost the capacity, lost the conscious level. So it means that the infection is advanced stage, spreading to the brain, and that's why the patient lost the conscious level. For me, it's not early detection. I don't know why you mentioned early detection. Anything here show that he is in the early detection state? I don't think so. So I think don't invent that we already early detect him or no. We are trying to give the antibiotic as soon as possible, but it's not early detection. Okay. Next, have you ever heard about meningitis? No, doctor, please explain to me. As you said, there is infection in the layers surrounding the brain, and it's advanced infection, serious one, by superbug called meningococcal infection or meningococcal meningitis, Neisseria meningitis, whatever you want to say, but don't give the name only. So you can say it's a superbug which can reach through the layers of the brain. Next, the manifestation. So we mentioned the pathology. Now the manifestation. Patient might be presented with fever, high-grade fever, might be presented with seizure, might be presented with loss of conscious level, which is already presented by your father. The complication. What's the possible complication? Coma, one of the complication. You can say even loss of hearing loss, or up to death, right? Some patients will be in coma, brain herniation, brain edema. We might lose the patient. So you can see up to death because it's one of the possibility, particularly if the patient discovered late. Then the management plan. We already started the antibiotics through the IV channels, admitted him, isolate him, as Dr. Maida did. In a side room, you cannot visit him now. We inform already the infection control team. It's a public team responsible for contact tracing. What's his job? He is a teacher, so we might ask to contact tracing, particularly the family member who was in contact with him in the last week. They might need to be given medication, which is called prophylactic antibiotics. No need to mention what is the medication. If she asks, you can mention whatever you want, or you can refer him or her or the family member who has this to infection control. This is the team responsibility, not your responsibility. The closure, advanced directive, and last thing about attorney, you have to ask in this scenario why, because this patient already lost the capacity. So you don't know. He will regain his conscious level or no? You don't know. It might be progressed to coma, brain death. You are not sure about, so you can ask about advanced directive, last thing power of attorney. The job we mentioned already in the infection control, and the other questions here. Anyone dependent on him? Do you need any support? And just give some leaflet brochures about the disease and close the scenario. Thank him or thank her. Ask her about any concern. This is, I think, how to do the meningococcal. We did it before, so you can do it. You can hear the session before. Try to avoid jargons, Dr. Maida, because you mentioned some jargon. Okay, try to avoid the jargon, the medication, the anti-bug, bug, super bug. Okay, all this will be better if you mention non-medical words. Okay. Do you have any question, Dr. Maida?
No, thank you. Thank you very much.
Okay, anyone has comment? We have 6 minutes, sorry, because I'm outside, I have noise surrounding. So anyone can comment or want to comment, please? We have 6 minutes still. Any question? Any doubts?
يعني في كومنت صغير على موضوع الادفانس دايركتيف او الباور اوف اتورني في حالات الكانسر وكرونيك ديزيزز.
Yeah, but please try to comment on English, Dr. Joe.
Yes, yes, and only in a power attorney and the advance directive may be valuable for case who know that he is coming to the end of his life and know he needs somebody to help to take decision for his health while he will ultimately lose his mental capacity. But this patient, he didn't know that he will lose mental capacity. He's an acute incident, acute infection. He was good 1 week ago, and he's a teacher, and he's working in his school. And once it is altered and fever, altered conscious level. So it is I mean, this to ask about the advanced directive in this condition, he doesn't know that he will face this acute incident. I don't know this will be helpful in this condition or not.
Yes, in acute, not ask about last and power of attorney advanced directive. In acute insult, not ask.
Second thing about the meningitis, meningococcal meningitis. Yes, Dr. Basim, يعني very كل اللي أنا everything I want to comment about the death is maybe sometime death is one of the possibility. Yes, it is still there. Minor of cases, even if he takes the medicine, he will may died. And about disability, because some cases we have an irreversible disability of some of his sensation. So we have to tell about this, not just hearing, maybe other sensation, and not maybe gait, maybe motor, maybe any other sensation. So we have to tell about disability, about partial disability, about this, even if the patient is treated. Some cases would not be succeed to be completely managed. However, yes, the majority of patients nowadays, because there's a lot of antibiotics and new antibiotics, we have to tell about that. There's a very good, very potent medicine that cures this condition. In the past, it was fatal, but now we have a very good variety of medicines that will control and eradicate the infection. But still, there's a minority of cases will not respond and have even this, some sort of disability or even this.
Okay, thank you, Dr. Joda.
Doctor,
Good,
I
good
have one
comment. Okay,
question.
yeah, go ahead.
Okay, you need to assess the hearing loss after the patient recovery or not.
You can mention it, but since the patient is comatose, it's not the time to assess the hearing. He's already in coma. If he recovered, yes, we might do that, but it's not the time to mention it.
Yes.
But it's okay. You can do it as a complication, okay?
Yes, as a complication, but not to say to the family you need to assess the hearing loss after the patient recovery. Mention as
Yeah.
complication.
Yeah, one of complication, not as
Okay.
a measurement. Okay,
Okay.
the next thing for the advanced directive. For me, my opinion, if the patient loses the awareness, so I can ask because, yeah, it's not expected, but he already lost the capacity, so I can do so. This is my comment, and I'm sorry about the noise surrounding. Anyone has comments, please, he can share before ending the session. Any comment, any suggestion?
يعني انا مش عايز افتح الحلقه الاولانيه بس عشان حضرتك ماشي النهارده بدري عندك you have a condition يعني بس the first patient was دكتوره دكتوره هند اعتقد اللي about suspicion every case the suspicion have different mean يعني if I say a suspicion mass is the liver by CT criteria is enough for diagnosis for liver HCC diagnosed by CT for lung. If I say suspicion mass was consistent with cancer, this means this patient has typical pattern of cancer, but need to be
Yeah.
confirmed by
Yeah,
biopsy.
Dr. Hind said good comment. She said this is practical, not basis
Yes,
wise. Okay,
yes.
practical, okay, but this is
She
different.
mentioned
Yeah.
a very good example about
Exact,
multiple
yes.
sclerosis. Multiple sclerosis, especially if I have a suspicion that he has demyelination by MRI, it is MS because MS is
Yeah,
diagnosed
there is
clinically, not diagnosed
McDonald's. Yeah,
by
McDonald's.
biopsy.
Yeah,
Yes,
there is McDonald's
especially if
criteria.
I
Exactly.
yes, if I say this patient will not be treated as MS, this is a crime. This patient has MS because he has different type, two space of time, space of site, to space of time, to space of site, and we have confirmed by MRI this patient has MS. The demyelination suspicious, you realize they like this suspicion, demyelination, suspicious for MS. However, this patient has MS by clinical diagnosis. So some suspicious, كلمة suspicious is different meaning in different practice. Don't have the same meaning in the same disease, on all diseases. So we have suspicious mass consistent with lung cancer. I mean, this patient has typical, I will say not have lung cancer, we have typical lesion for lung cancer. I will have typical or consistent lesion with lung cancer. I will use typical or consistent with the same language. But why not say that it has the lung cancer? And we will wait for biopsy to know which kind. Like this. We will not confirm in our language, but we will say like this. It is suspicious mass. It means not suspicious cancer. Suspicious mass not mean suspicious cancer, by the way. Suspicious mass consistent with mean it is typical for this condition. And not like every condition suspicious has different meaning, by the way. I don't know.
Okay, thank you, Dr. Judah. I have to end the session now. Okay, thank you everyone. See you inshallah in the next session. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.